Hello everyone, my name is Ruantika Surya. Today I'll be presenting my analytic storytelling project. My research question is what factors most significantly contribute to the detection and diagnosis of lung cancer? Throughout this presentation, I'll explore this question using global data visualized through Tableau. We will look at various factors such as smoking habits, air pollution, age, gender, healthcare access, and more to understand their impact on lung cancer detection and diagnosis worldwide. To answer my main research question, I used four sub questions. How do country, age, and gender influence the risk of lung cancer detection? How do smoking habits and air pollution impact lung cancer prediction? How does the availability of healthcare services and family history influence the prediction of lung cancer? What is the correlation between living in an urban rural environment and lung cancer risk levels? To begin with, I prepared data to make it easier to visualize and analyze. I group individual countries in broader regions such as South Asia, Africa, and Western Europe so we could spot regional patterns more easily. Next, I categorized ages into 10-year brackets starting from 30 to 40 to 30 and up to 81 to 90. I also created combined age gender variable to help examine how age and gender interact in lung cancer predictions. Fortunately, the dataset didn't have any missing values or outliers, so it was clean and ready to use. Now looking at this tree map, you will see that Africa has highest number of predicted lung cancer cases, followed by Southeast Asia. This likely reflects high environmental exposure and limited access to quality healthcare in those regions. The bar chart shows that 30 to 40 age group has highest number of predicted cases, which is a bit unexpected. Also, it's interesting to note that females over 60 years show higher prediction rate than males in the same age group. These findings suggest that age and gender specific prevention and intervention strategies might be necessary. This bar graph shows predicted lung cancer causes based on smoking status and exposure to the secondhand smoke. As expected, the highest number of predicted cases in among smokers and former smokers, which aligns with existing medical research in smoking being leading risk factor. What's important to note that secondhand smoke also contribute to significantly the predicted cases, even among those who don't smoke themselves. This may highlight the need for strong public health efforts, not just for encourage smoking cessation, but also predict people from passive smoking exposure, especially in shared environment like homes, public transport, and workplaces. This chart presents lung cancer predictions based on level of pollution exposure categorized as low, medium, and high. What's surprisingly that is that even areas with low pollution levels show relatively high prediction rates. This might be explained by better access to healthcare and diagnostic in those regions, which leads to more reported cases. It also suggests that air pollution alone it isn't only factor driving predictions. Other risk factors may also be at play, like genetics, smoking, and occupational exposure. So it's important to interpret these results in a broader context rather than assuming pollution is the sole case. This chart highlights the impact of healthcare access and family history in lung cancer predictions. We can see the regions with better healthcare access and screening programs show higher detection rates. This relatively reinforces the importance of investing in healthcare and infrastructure for early diagnosis and better outcomes. Interestingly, having family history of lung cancer doesn't appear to significantly raise the prediction rate. Here we compare predictions by socioeconomic group. The middle income group had highest number of predicted lung cancer cases, followed by low and high income groups. This could reflect balances between exposure and partial access to healthcare, enough for diagnosis but not always enough. This suggests that environmental and behavioral factors like smoking, pollution, and access to care may have a much stronger influence on lung cancer risk than genetic alone. Here we observe that 70% predicted cases are in urban areas. This may be due to higher pollution levels, passive smoking, and better healthcare infrastructure that supports more frequent diagnosis. Only 30% outcomes from rural regions, which may reflect underdiagnosis or lack of access to screening. This graph highlights the most cases non-small cell lung cancer and are detected at the age of stage 2 and stage 3. This shows early detection is still a major challenge, and many patients are only diagnosed when the cancer is already advanced, reducing their treatment options. Now let's walk through the key findings from the visual data analysis, starting with the region. The highest number of predicted lung cancer cases was observed in Africa, while the Middle East and Eastern Europe reported the fewest. This could reflect differences in both environmental exposure and healthcare access. Looking at the age and gender, with the age 30 to 40 age group showed the highest number of prediction overall. Males dominated most age categories, but interestingly, female over the age of 60 showed a noticeable increase in predicted cases, indicating the need for more targeted screening in this group. As expected, smokers and former smokers had the highest rate of predicting lung cancer. However, this stood out was the significant impact of secondhand smoke, which contributed heavily to predicted cases even among non-smokers. When analyzing air pollution exposure, something unexpected emerged. Even low pollution zones reported high numbers of lung cancer predictions. This might be due to more effective diagnosis in those areas or may not indicate other underlying factors at play. In terms of cancer type and detection stage, most of the predicted cancers were non-small cell lung cancer, and majority were detected at stage 2 and stage 3. This late stage detection suggests a clear gap in the early diagnosis effort. We also found good health care access and high regular screening significantly improved detection rates. Underline how critical infrastructure is early diagnosis. Looking at the residential settings, urban areas encountered about 70% of the predicted cases. This could be linked high pollution levels and simply better access to diagnosis facilities in the cities. As for family history, it did not strongly correlated with the prediction outcome. This may be indicate that lifestyle and environmental factors are more influential than genetics in this context. Finally, we observed that the middle income group experienced high level rate lung cancer predictions. This group likely represent mix of risk exposure and partial healthcare accesses, making it priority for future public health strategies. Now, our conclusion is this analysis shows that lung cancer prediction is influenced by a combination of healthcare access, environmental conditions, and lifestyle behaviors. One of the most significant findings is the smokers and individuals exposed to the secondhand smoke are at the high risk, which reinforces need for strong anti-smoking interventions. Another important point is that most cases are detected at mid-stage, such as stage 2 or 3. This highlights major gap in the early diagnosis, which can drastically affect patients' outcome. We also observed that people with better access to healthcare and screening services are more likely to be diagnosed, reinforcing the need to expand these services, especially in underserved areas. Interesting, we found some unusual patterns such as high prediction rates in low pollution areas and weak correlation with family history. These patterns suggest that further investigation is needed to understand the role of air quality and genetics in lung cancer prediction. Finally, our recommendation focuses on improving access in rural areas, expanding screening programs, and increasing public awareness, especially in high-risk population. Thank you for watching this video. I hope it gave a clearer understanding of the key factors influencing lung cancer prediction and the importance of early detection and targeted health strategies. Let's remember, when it comes to lung cancer, prevention is always better than cure. By reducing risk behaviors, improving healthcare access, and raising awareness, we can make a meaningful impact.